When your patient is intubated with an ET tube, your bag mask, without the mask, is going to attach to the tip of your ET tube, and you will give breath this way, okay? Until they bring you a securing device to secure that ET tube, okay? And then you're just gonna deliver breaths 1 second at a time, squeeze and release, okay? On intubated patients, you're gonna deliver a breath about 1 every 5 to 6 seconds, okay? Now, if your patient has a trach in place, then you would attach it to the trach itself, okay? Okay? So we're going to talk next about suctioning. How would you suction for a patient who is intubated? This is called a closed suction device, okay? It attaches directly to the ET tube or directly to the trach, okay? Now, remember when you're using this, if this is set up, this link here tells you this is for an ET tube, okay? So we have to be very delicate when we're using these that we don't go too deep. Now, they do make these for the trach, and we do have those, or should have those in your hospital as we have them here, okay? You would attach this to the suction device at the suction tip, okay? Now, with this one, you would pause the bag, giving the breath, and you would feed this all the way down, okay, until it's had to stop, and then you'll push this down. Got to open back up. And you'll push this down and bring it back out, okay? And then release it. Give him a couple of breaths. Put your bag back on. Give him a couple of breaths. Okay? You can instill saline through here. You can give them some saline through there, and you can feed it down against it. Just feeds. It stays sterile, okay, because it's enclosed in this sterile case, and then you just pull it out with your suctioned secretions, okay, and then you go back to breathing, okay. If you see that he starts to have it again, if you see he's got some oral suctioning, some oral secretions that need suctioning, we'll attach what's called a Yonkauer tip device. We'll attach the Yonkauer tip to the suction port, and we will go to the side of the ET tube and suction out their mouth, okay? There's no need to go too far down, okay? You just want to get all the secretions that are in the mouth. You can continue to bag during this procedure of oral suctioning with the ET tube, because that's not going to interfere with the breath going into the lungs, okay? Now, the same would hold if you were going to suction the ET tube. Place that on there. This little tube here goes, this is where you're going to give your breaths. You're going to oxygenate. Then you're going to feed this down the tube until it stops. Once it stops, you pull back just a hair and push this down, okay? And then you continue to bag. Now 1 every 5 to 6, making sure what your oxygen saturation is on the monitor, okay? Always watching for secretions. If it gets to be difficult to bag, you may have to instill some saline and then suction again. Okay, till you hit resistance, pull back just a hair and pull it back, okay? All right.